All right, welcome. This is our presentation on June 11th. We have two guests with us today. Before we jump in, Chantal from Banyan Tree Women's Collective. We are a 501c3 Bay Area nonprofit, and we believe that health and wellness access should be available to everyone, regardless of your age, income, zip code, race, or any background. So we exist and we want to share holistic health and wellness to everyone and as far and wide as we can reach. So offering these classes online is one way that we can do that. Today we have two guests with us. We have Ellie and Alex, who are both doctors of clinical psychology, and they're going to be co-facilitating a presentation today on the topic of substance use. So I'm gonna let both of them jump in and share about themselves.
Wonderful. Thank you, Chantal. Hi, everyone. My name is Alex, and I am a therapist in the Addiction Medicine and Recovery Services Department. And I'll pass it to Ellie to introduce herself.
Yeah, hi, I'm Ellie. I am currently a therapist working with children and families, but last year I was specifically working with adolescents in addiction medicine and recovery. So this is a topic that is near and dear to both of us.
Yes, absolutely. Oop, I might need permission to share my screen,
Oh.
but no worries.
Hmm. Did you? Oh, there we go.
Okay, perfect. Okay. Alrighty. Can folks see my screen?
Yep.
Yay. Perfect. So, um, just as we mentioned before, we'll be talking about substance use and its overlap with mental health. And we do want to kind of create a space where substance use is destigmatized. So any conversation about substance use is welcome here. It is a safe and non-judgmental space where we can talk about it. Um, we also want to acknowledge that it does have a lot of overlap with mental health and systemic issues as well. So if those do come up, we ask that, yeah, folks have an environment of respect for one another, and just create a very inclusive and compassionate space, which Ellie will speak about now.
Yeah, so in order to make this a safe space and a place where we can have open and honest conversations, we want to make sure we are respecting each other. And so, in order to do that, we want to make sure that we are following a couple guidelines. First of these being that, we want to make sure we are speaking for our own experiences. We want to be using I statements, making sure that like we're not speaking about someone else's experience. We're not going to be outing, our family members' experience or a friend's experience. We want to be sharing about my experience with substance use or my experience with mental health. We also want to recognize that everyone and everyone's life and recovery journey is both unique and similar in different ways. They have elements that are shared, and yet everyone has their own journey. So while there are topics that we will discuss that we will make some general statements about, we also acknowledge that everyone has had a different experience and everyone has had their own life. And different identities and different backgrounds will play into that. And so while we will be making some statements, we want to acknowledge that it might not apply to everyone. Uh, we also want to refrain from giving advice. We will try to do our best to offer what sort of advice we can give in terms of mental health and support, but we want to have audience members and everyone refrain from giving specific advice, as what might work for one individual might not work for another. And then overall, we want this to be a supportive environment. We want to really focus on harm reduction and use in moderation, um, or abstinence if that is their goal, but knowing that each person might have a different goal when it comes to substance use. And so while one person's goal may be to never use anything ever again, another person's goal may be to just simply cut back. And we want to respect each person's goal for what it is and know that their goal is valid.
Great. Thank you, Ellie. Yeah, so we wanted to start off just by addressing some substance use statistics. These are from 2024, so they're a little bit outdated, but still, I would say substance use is still, very relevant in mental health conversations and very relevant topic for today's society. So in 2024, among people 12 or older, about 16.8% had a substance use disorder in the past year. Um, and the amount of folks who are using substances has increased since 2021. And actually, interestingly enough, that statistic surprised me also just because of the pandemic as well. And I'm curious to see kind of how things have changed since then too. Um, Wish we had a little more updated statistics. But in 2024 as well, among the adults who perceive that they ever had a problem with alcohol or drugs. About 74.3% considered themselves to be in recovery or to have recovered, um, which is wonderful. And that's something that I've really come to love to work with and see these folks' journeys and see the healing that can come out of recovery. And I really think that this is the point to take it home. About 21.2 million adults suffered from both a mental health disorder and a substance use disorder. So the co-occurrence of mental health issues and substance use are very common. And in addiction medicine and recovery services, we definitely target the underlying conditions a lot more than the actual substance use behaviors, albeit stress or trauma or other difficult life circumstances. We always say that there are reasons people use their substance of choice in some way that it's serving you. And if it were that easy to stop using, you would have done it already, and I wouldn't have a job. So it's this vicious cycle that is hard to step out of, and a lot of folks have been in it for a very long time. So just to normalize that experience and also acknowledge that healing is possible and recognize that, it takes a push, and that, yeah, there's a lot of barriers to change. Because these substances may be providing an escape or a sense of relief or groundedness from life is super stressful. Life is heavy. Mental health difficulties are challenging and are hard to cope with. Dysfunctional relationships are hard. So, um, all that to say that these substances, at least with the patients that I work with, are likely serving them in some way, and stopping them can be really difficult. But we'll talk about some ways to combat that and alternative ways to coping with these life stressors.
Yeah. So when we talk about, how to first approach, treating substance use, we want to look at what are the different approaches. And so we tend to categorize this into two main categories. There is a harm reduction approach and an abstinence-based approach. And we'll dive into that a little bit, but it is important to acknowledge that before we even get into the nitty-gritty of going down either of these paths, the very first step in recovery is destigmatizing substance use. Specifically diving into a conversation about, the different perspectives of substance use. There is a lot of stigma and shame around substance use, and that can be a major barrier for people getting help and getting support around getting help for these behaviors. A lot of times it is seen as like a moral or like a personal flaw to be engaged in substance use, when most people aren't using substances because they want to be a bad person. A lot of times it is because they are doing the best they can with a difficult situation. And they are not continuing to use substances because they are deciding, well, I don't care anymore. They're using it because that seems to be the only thing that is helping them right now, or the only thing that seems to be working. And so when we have all of this stigma around substance use, there is this kind of need to keep it a secret. There is all this shame around the idea of using, and it makes it a lot harder for people to reach out and get help. And so the more we can break down this stigma, the more we can make it normal to talk about, hey, I've actually been drinking to deal with my depression, or I've been smoking to kind of combat my anxiety, and I think I might be relying on it a little bit too much. It allows us to open up these conversations. It allows us to go to others and say, I might need help. And it opens up those pathways to getting treatment and to getting support. And that allows us to then choose which way we want to go with that treatment. Do we want to go down this harm reduction route or an abstinence route? So within harm reduction, the goal is, as it sounds, reducing harm. It's not this idea of completely stopping everything, but rather trying to minimize the negative consequences that are associated with use. A lot of times when people are first introduced to this idea, we see it, often associated with like the heroin epidemic, this idea of like needle exchanges, trying to reduce the, disease that could come with sharing needles, the, negative consequences that could come with potentially, having substances that are not pure or mixed with other substances. And here, with the harm reduction approach, it's about really meeting an individual where they're at. Our goal is to not try and convince someone to completely change their life and give something up, but rather meeting someone where they're at. If their goal is to not completely stop, that is okay. It is not our goal to try and convince them otherwise. Our goal is to help them live the best life they can with what they're doing and to try and just decrease any additional harm that might be coming from their behaviors. And this is often a great starting step towards a life of recovery because once we are able to reduce those harms and begin to learn other ways to cope with other stressors in our lives, it become a lot easier to let go of that dependence on the substance. And then that individual can take another look and decide, do I want to continue with harm reduction or do I want to maybe give up this substance? Or do I want to have this be a once in a while fun time thing, where I maybe go drinking with friends on a special occasion rather than needing it to be an everyday occurrence? And this can be a very flexible treatment for people. So if they're not sure where they're at on their recovery journey, this can be a great place to start. The abstinence-based approach is the one that people more commonly assume is substance use treatment. That's going to be your 12 steps, your AA. That's going to be the idea of completely stopping all substance use, focusing on sobriety as the foundation of healing and never coming back to it. This idea of never touching a substance again. And this is a very structured treatment. It often involves a lot of support from the community, from your family, from those around you. And there is not one way that is right or wrong. It is your personal preference and the way you want to live your life. Some people find that they are able to do harm reduction and they are able to decide, yeah, I can engage a little bit and I'm okay. Other people have found that, my self-control around this specific substance is just not there. If I do a little bit, I go way too hard. And so I need that abstinence. And it comes down to the individual as to which approach is going to work best for them and which goal they want to try and achieve. And so it is up to you and whoever you are working with on your recovery goal to decide what path is going to best fit you and best fit your goals. But in the end, knowing that you have options. And so when you are deciding, hey, I think I may need help, knowing that you don't have to instantly dive in and just go, I'm giving up everything right away, unless that is what you want to do.
I think something that Ellie really kind of hit home for is the fact that there's a choice, and that kind of contributes to minimizing the stigma around substance use, and knowing that treatment is a space where you can have options and can make a choice for yourself because you are the expert of your experience, and that your counselor or whoever is working with you will walk with you in that. So more generally, this recovery process is a process of change, where people improve their health and wellness, live self-directed lives, again, kind of going back to this notion of choice and um, yeah, this self-directed way of living, and then strive to reach their full potential without being dependent on substances. And that may include still using substances, but knowing that there's an option. Um, so people with severe and chronic substance use disorders can, with help, overcome their substance use and regain health and social function. Again, this liberation from the cycle. And then positive changes become a part of this voluntary adopted lifestyle. Different coping skills are integrated into everyday life, into habit, into routine as alternatives for substances. And again, like we said in the beginning, recovery can look different for everybody. The coping skills people use can look different for everybody. Harm reduction versus abstinence, those journeys look different for everybody. There's no right way of doing recovery. And especially with the added layers of mental health difficulties, systemic issues, and other life stressors and circumstances, there are so many things in the world that we don't have control over. But recovery is about harnessing the things that you do have control over and experiencing that change and growth and healing from being able to regain that sense of control in one's life through choices and options and having that safety to process through all of that. So again, just kind of lessening the pressure of recovery and more emphasizing that it's an open space of freedom, of liberation.
Yeah, so we've thrown around this word coping skills a little bit, and may or may not know what this is. So, coping skills are essentially the tools that we have to help us when something is not going well. These are the reactions and behaviors we adopt to deal with a difficult situation. Some of these, kind of strategies can be helpful, others may be harmful. And so, substance use is one of these coping tools that may end up being more harmful than helpful. And so part of recovery is really trying to help us find what are coping tools that will actually benefit us in the long run, that'll help us maintain a healthy lifestyle, and that will help us cope with those difficult moments in life, that'll help us deal with challenging emotions, that'll help us get through stressful times, that'll help us overcome those really intense moments where we don't know what we're going to do, how we're going to act, and we feel like maybe things are a little out of control. And so, in order to really help ourselves overcome that dependence on substances as a coping tool, we need to develop other skills.
And one of those skills that we'll be talking about today is called self-compassion. And this is, again, a coping skill that y'all can try. It's, again, not every coping skill is going to be a perfect fit for everybody, and that's totally okay. It's kind of like a buffet model. So whatever works for you, you can keep using it. If you're not down for it, then that's all good. And since every recovery journey is different and unique, some things will work for some and then some won't be as useful. So we'll be talking about this coping skill, and if it incorporates a lot of mindfulness practices and perspectives, and it addresses a lot of the emotional component of substance use. So learning these emotion regulation strategies that folks in recovery, typically experience. It's also helpful with stress. So even if folks aren't in recovery, they can totally use this to combat any kind of life stressors or emotional difficulties. Some of the components of self-compassion are one, self-kindness or loving kindness, which emphasizes the importance of being supportive and gentle to oneself. we all go through so much every day. There's so much heaviness in the world, and there's feels like there's little time to recognize our own strengths and resilience in the day and age. So self-kindness really emphasizes that need and that healing aspect of self-compassion. Um, the second component of self-compassion is understanding common humanity, which basically is that all humans are imperfect and make mistakes. It's about human connection and connection through um, that authenticity, that imperfection, and knowing that not everyone has it all together. Um, yeah, including me and Ellie, and that's okay. And we're in it together. And then the last component of self-compassion is mindfulness. So being aware of one's suffering with clarity and non-judgment, and finding a sense of groundedness, and understanding and self-reflection through this mindfulness, remembering that we are remaining in the present and that we are here, we have control over our breath, we have control over our body movements, and finding centeredness and groundedness in that.
All right. So, as a part of this, we need to understand the difference between self-kindness and self-judgment, which may seem obvious on the surface, but it can be really hard to actually incorporate into ourselves. It can be easy to do for someone else that we care about, but we are often much harsher to ourselves than we would be to someone else. And so it's really important to remember to actually treat ourselves with care rather than really judging ourselves harshly. Understanding that it's okay to allow ourselves to have a little bit of grace, to know that, hey, when we are struggling with a difficult situation, like we can take that context into understanding. We don't have to be overly judgmental. It is all right to be actively like soothing and comforting and supporting and protecting ourselves. Just because cognitively we think we should know better doesn't mean that it's not okay to take a break, to ask for help, to maybe do something to just make ourselves feel a little bit better from time to time. Because in the end, harsh self-judgment is actually just going to make things harder for us. In our body, it's going to activate a threat system. It's going to cause us to be on alert. It's going to release cortisol and adrenaline. It's going to trigger that fight or flight. It's going to just increase our body's stress levels, which is going to then make us feel like we need to be doing even more. It's going to make us want to engage in that substance use because we're going to be more stressed. So even if we're feeling like, no, I need to be hard on myself, so I stop, that's actually going to be counterintuitive. Because if the more we're beating ourselves up for something, the more we're stressing ourselves out, and the more we're actually going to be craving or yearning for that unhealthy coping skill because we're overwhelming our internal system. So it's really important to not beat ourselves up. And so while that like internal self-criticism might be trying to help, it's much more important to be kind. And so the more you could really talk to yourself the way you would talk to your best friend is a really great piece of advice. And, if you can talk to yourself the way you would talk to your internal, like little self, you at 6 years old, or if you would think about, hey, would I let someone else talk to my friend that way or my loved one that way? Then why would you let yourself talk to you that way? And so you got to really try to separate that and see, you know, can I be kinder? Can I reframe this in a way that's maybe just a little bit softer and giving myself a little bit more kindness and understanding?
Yes, and kind of delving deeper into that notion of self-kindness. Again, we all carry so much with us in life, through life, and that could include suffering or grief, trauma. And one of the biggest parts of self-kindness is knowing what we can and can't control. We can't change the past. We can't change, the difficult some of the difficult life circumstances we're experiencing. We can't change whole systems in the world, but we can change how we're breathing. We can change our relationships in some aspects and sometimes not. We can change how we're sitting. We can change how we talk to ourselves. And I think that's something that Ellie was explaining really well, is that we can give ourselves words of validation, reassurance, encouragement. And through this, we are engaging in this really messy space, and finding ways we can be kind to ourselves through it. Ellie will talk about this in the next slide, but we can offer ourselves a hug or a pat, like in this picture, and seek that sensory groundedness. That is also something we have control over. We can speak to ourselves in friendly inner voice tones, being gentle. Literally, if you're looking in the mirror and giving yourselves those validations, those reassurances, the affirmations, say it in a kind and gentle voice, just like you would talk to a little kid or talk to your own inner child. And through this, we take helpful action towards healing and, um, yeah, even in this suffering, trying to find spaces where we feel empowered, reassured, um, and affirmed in the safety of it.
Yeah. So along with speaking to ourselves kindly, there are physical things we can do that, while it might seem really cheesy in the moment, science actually shows causes us to be kinder to ourselves, causes us to feel more compassionate, causes us to actually like lower our guardedness, lower those like defenses that we have. So one of them is kind of putting your hand on your cheek. There's something about that like physical touch that allows us to just feel comforted. Same with kind of cradling both hands in our face, you know? There's something about the touching our face that we tend not to do when we're feeling defensive or upset or angry with ourselves. So even if we're having those negative thoughts, by physically having ourselves go and do that touch, it's telling our brain, hey, it's okay to be kind to ourselves. It's sending those signals and it's kind of biohacking our system to tell us we can love ourselves, we can be kind. Very similar, putting a hand on your abdomen or over your heart, noticing how is my breathing? How is my heart rate? Becoming very one with your body, noticing, can I just relax? Can I just be present in this moment and slow everything down? Or kind of holding your hands, putting them in your lap. Again, just really noticing, like, can I just be here for myself? Can I just like exist rather than trying to grab all of the things around me or be frantic in this world where we're often on the go trying to handle so many things? Just allowing ourselves to exist for a minute, sit there, feel just some human touch, even if it's the human is ourselves, knowing that it's okay to just be there and allow ourselves to be in the present. Some other things that can help too, noting that like if you're very anxious, having some external things like a stuffed animal that we love or a weighted blanket can help us feel protected or safe. Noticing other sensory things like a smell that reminds us of like grandma's house or a warm cooked home meal can just make us feel loved and safe. Knowing that on a day where maybe we're feeling so overwhelmed, a sound that is calming or the sound of rain falling can help us remember, okay, it'll be all right. And so finding little things that can help us just feel calmer in the moment and help us relax can go a long way. Because if we are so focused on the world around us, then we're not going to be really paying attention to what's going on internally. And it's a lot easier to fall back into those patterns of being hard on ourselves and focusing on those external stressors. So it is really important to take a moment to engage in these self-compassion gestures because it allows us to actually show ourselves a little bit of care and love and refocus on how can I take care of myself, even if just for a few minutes.
And I think along with these gestures as well comes the self-kindness talk. So some of the things that we were talking about previously about how we talk to ourselves, we can also do at the same time as we're, kind of rubbing our hands or putting our hand on our heart or abdomen or our cheek. Um, and kind of to elicit those gentle and compassionate phrases, think about a time when you had a good friend come to you when they were suffering. Here are some questions that you might want to ask yourself. What might you say to them? What might you do? What would your voice sound like? And what would your posture be? Um, and then think about a time you've been struggling. Not a major event, but maybe something a little bit less intense. And ask the below questions as well. What might you say? What might you do? What would your voice sound like? And what would your posture be? I've had some folks do this activity and say that those two situations are vastly different. What they might say is, yeah, super on opposite ends of the spectrum. Some folks have shared that, they're very gentle with their community, with their friends, but with themselves, it's continually criticism and judgment. They're like, why do I need to slow down? Why do I need to take care of myself right now? Even their tone is a little bit different. I had my supervisor say, like, saying Alex is very different than saying Alex. And, noticing those different tones and how we might be talking to ourselves to elicit the fight or flight response. It's very important to notice these differences and perhaps use the same posture and tone of voice that you might use for a friend for yourself, because you deserve it. You deserve a space where you feel held and supported.
You can also formulate some of your own practices for self-kindness by implementing some of these skills. So, one that can be really effective for people is by figuring out their own phrase for a loving kindness meditation, figuring out exactly what words of kindness that you need to hear that'll have a real impact, something that you wish for yourself. You can kind of ask yourself, what do I need? What do I need to hear? Or what would I need to hear? Or if I don't hear it, my day will feel incomplete. What am I missing? What is something I wish I heard? Or knowing, hey, what is a reminder that I know I need to hear? Beyond just that something basic that you could pull up on YouTube from a generic meditation, what is something specific to me that is going to be really impactful? And then this is a phrase that we can think when we really need it, or that we can offer to ourselves, both as a daily reminder or when times are really tough. And so, one example that we have here is like, I know my value. I feel I belong. May I begin to love myself just as I am, and may I stay safe from harm. Knowing exactly what I need to hear in that moment to know that I can get through anything. And for each person, this will be different, but that's what makes it most effective, is that it is tailored to your specific needs.
Oh no. There you go. On that same note, here are some phrases that I've heard before that folks have used to help them ground in this self-kindness. Um, Feel free to take a mental picture of this screen and find ones that speak to you, find ones that stand out to you. I know for me, ones that stand out to me are, may I believe in myself? May I have courage? May I care for myself? Um, May I know my own value? I think those are ones that speak to me. And again, what Ellie said might be different for you, and it depends on your journey and kind of the things that you need to hear to feel empowered, to feel grounded. Yeah, and so again, take a mental note and choose ones that stand out to you. And we will be using these later, so keep that in mind.
Yeah, very similar. We can have ones around kind of that loving kindness meditation. And so this can be for ourselves, for a specific other, or for like a group. And so, again, some examples here might be, may you be safe. May I be happy. May they live with ease. Because again, we can be wishing or hoping good things for ourselves, but also for others in our lives or for the world as a whole. Because sometimes the distress we're feeling isn't just for ourselves, but for our greater community, for our family, or for our loved ones. And so knowing too that we can share this loving and kindness. And with these meditations, with these phrases, it can expand to those beyond ourselves. And so again, you know, we can pick out the phrases that are meaningful to us, but it can go beyond I, and it can go to really any of those that we feel are going to be beneficial for us to remember. Because also there is some power in really giving that kindness to others and sharing it with the world that can help us feel a little bit lighter.
And that brings us to our second component of self-compassion, which is common humanity. And just to kind of start us off, common humanity again it builds a foundation of experiencing compassion for ourselves and others, which could mean kind of sharing those phrases with other people, wishing other folks well. And it just connects us in our human experiences. And this is why self-compassion as a whole is so important in recovery, because we're all in this human experience together, and it reminds us that we're not alone. And I think it's important also in the destigmatization of substance use as well, in knowing that this is a very human experience and that a lot of folks are struggling with things deeper than just the substance use behavior, but also just the heaviness of life. And we can connect on that. And we can share that with one another, and vulnerability allows us to build those connections and that support and that, the self-compassion amongst the group. And that is what common humanity is about.
So, one way to kind of imagine common humanity is imagining that everyone you know is carrying a very heavy, invisible backpack that is full of their own personal challenges. And while the challenges within this backpack may be different, everyone is carrying one. These unseen emotional, social, psychological burdens that people are carrying are with them through their life. While one may be carrying grief, another may be worrying with crushing anxiety. One person may be fighting off some really scary health concerns, while another person may be really dealing with some intense financial stress. Everyone is carrying something. And while the individual thing we're carrying may differ, we all have something we're carrying around. And it is that shared burden that we are all dealing with something that allows us to understand each other, to have that shared compassion and that shared humanity. And so while we might not know what's in each other's backpack, we can know that at some point, everyone has suffered and that everyone needs some compassion.
Absolutely. And so, just kind of as this in a little summary, common humanity offers this message that all humans make mistakes, sometimes fall, sometimes get angry, experience disappointment, experience loss, or feelings of inadequacy. And even though we've experienced these things, we still feel alone in our suffering. We become self-focused, which can isolate us or make us feel defective. And it doesn't mean that our suffering is not important or that difficult emotions that come with the suffering aren't real or heavy. But when we acknowledge that we're not alone in our suffering, and our imperfections or our failings, we don't have to take them as personally, knowing that everyone else is going through this as well, even if they're unique. Everyone is going through something, just like Ellie said. And knowing this also helps us have compassion for others and gratitude for others as well, and kind of helps us build empathy for one another. And these connections can lessen our burdens as we're sharing it through common humanity, through understanding one another, through shared experiences, and through that vulnerability. But it does take a lot of courage. It's easier said than done, so I also want to recognize that. But once we take that leap, it also opens the door and opportunity for being supported.
And so we may feel alone in our suffering, but you know, we don't have to. And so there is this quote from Helen Keller that although the world is full of suffering, it's also full of overcoming it. And that is very powerful because it means we can overcome our struggles. But, why do we feel alone? If we know everyone is suffering, why do we continue to feel like we have to deal with it? And there are a lot of reasons. One of them is that pain really does narrow our focus. When we are in emotional or physical pain, our attention really does turn towards it. It becomes a lot harder to imagine what others are going through. It really becomes harder to think that anyone could understand what we're going through because what we're dealing with is unlike anything else we've had to deal with before. It is so sharp and so painful in that moment that imagining anyone else going through that seems completely unrealistic. And so we feel very alone in it. Another reason is a lot of cultural norms kind of encourage us to hide our suffering. And when we hide our suffering, it often causes others to hide theirs. Many cultures, especially those who value strength and independence and positivity, encourage individuals to hide their struggles, especially when they're in public. And so people then put on a mask. They try to project that everything is okay and I'm doing fine, when on the inside, they feel like the world is crumbling apart. And in turn, we assume that we're the only ones that are struggling, when in reality, we're probably not alone in having a hard time. And if we all actually were a little more honest about what we were going through, we would realize that that common humanity is there and we are all struggling with something. But it is that cultural norm of putting on a brave face that makes it harder to talk about. Another one is, yeah, suffering feels personal. It is often very scary to open up. It's very vulnerable to share something that is so painful and so deep. You know, when even if someone has experienced something similar, like grief, or trauma, rejection, our own situation is unique to us. It has our own history, its own meaning, its own specific texture or flavor. And that uniqueness can often make it feel like no one will understand. It's exclusive to your own experience. And so even if someone is saying, yeah, I've been there, I've had that happen, it feels like they don't fully get it. They'll never fully understand. And then a lot of times shame can make us feel like we have to be silent. A lot of times we will feel like we can't reach out to others. There's a belief that people may judge us. They won't understand. And so we have to hide. We have to conceal anything that we might be doing to cope, or that whatever it is that we are struggling with, we can't talk about it because instead of people getting us help, they would just shame us for it. They would tell us we're bad. And so instead of actually dealing with the problem, we're just going to hide in it further. And all of this just makes it so difficult to actually get help. And so that's why groups are really important. That's why getting help is important. Because while it's difficult to speak out, once we do, it actually allows for a safe place for naming our experiences, for seeking connection. And it allows for that common humanity. It allows for us to realize that sometimes we might be carrying the same things in our backpacks. Or even if we're not, our backpacks may be the same weight. And either way, all of our backs are hurting from carrying it. And we can at least empathize with that. And we may understand what it's like to be tired and to need a break.
I encourage you all to think of maybe some aspects of recovery or mental health difficulties that you've experienced that you felt alone in. And then maybe upon learning about others' experiences, you felt less isolated or you felt a sense of connection, or maybe I'm not alone in this. Um, and then what are some of the challenges that you faced that you think others have faced too? Or maybe some that you face that you feel like others have not faced before. Just take a moment to think about it. This is kind of a long story, so I encourage you, just for the sake of time, I encourage you all to, again, maybe take a screenshot and whatnot, and read this. It's kind of a beautiful narrative with beautiful imagery that demonstrates I guess can't think of another word, but beautiful. Um, yeah, the reasons why common humanity is so important, understanding that everyone has their own cracks, their own things that make them tick. They're things that they carry with them in their backpacks. So go ahead and take a picture of that and read it. It's called The Cracked Bowl. Okay. And kind of on this last bit of common humanity, um, there's also a common humanity meditation, which emphasizes compassion for one another. So kind of to bring you through the visualization of it, bring someone to mind that you don't know very well, maybe someone who seems distant or different from you, even someone you're in a minor conflict with, if that feels like it fits. And then say to yourself, this person has a body and mind just like me. This person has feelings, emotions, and thoughts just like me. This person has at some point in their life been sad, disappointed, angry, hurt, or confused just like me. This person has in their life experienced physical and emotional pain and suffering, just like me. This person has experienced moments of peace, joy, and happiness, just like me. This person wishes to have fulfilling relationships, just like me. And lastly, this person wishes to be healthy and loved, just like me. And again, take this moment to reflect on any kind of experiences that you just had in your body, in your heart, in your mind, as you hold this person. Maybe even send them some good wishes, some loving kindness as well. But again, we want to emphasize how important it is to have connection, to have understanding of one another, maybe noting the similarities that we have with people in our community.
All right, so that brings us to kind of the third part, which is mindfulness. And so mindfulness is very important for honestly being present. A lot of times mindfulness gets kind of conflated with or incorporated with the idea of meditation. And that's while it is important for that, it is really about being connected to the present moment. It is a mental state that is achieved by focusing on the present moment, by just acknowledging one's feelings, thoughts, and the sensations that are occurring at that time. And it has been shown to be very, very effective in helping with, well, both regular well-being, but especially with treating substance use disorders. One study found that mindfulness may be a facet of self-compassion that is significantly associated with the reduction of alcohol use. Specifically, being aware of oneself in that moment. What is going on? Where are these urges or cravings coming from? And can we just exist and be present in the moment rather than seeking that next sensation or escaping whatever is going on? Can we practice just being there, existing?
Absolutely. And just as Elias was saying, that mindful awareness is non-judgmental, not trying to suppress or deny one's experiences, one's suffering, or maybe I should be feeling this way, or I should be doing this, but just noticing the thoughts that are coming into mind, observing one's thoughts and feelings just as they are, without trying to judge them or suppress them or push them down. And awareness is the first step towards change. In a life where autopilot and the grind is very much emphasized and encouraged, that could lead us to just act out of habit. And that could include using substances, which is a behavior that may feel like a knee-jerk reaction or a habit that one has just developed in response to these life stressors. So the key to making change would to stop and be aware of what's happening in the moment, and take more of a neutral observer role rather than a judgmental role. So mindfulness invites us to not be over-identified with the thoughts and feelings that we're in, but rather just noticing and taking a time to check in internally with how we're feeling. Um, and then also notice if we are being critical of ourselves or judgmental. Um, and again, with this awareness, hoping to stop and pause and just, release those thoughts. So again, looking through our options and playing the tape forward with, things, our decisions, our behaviors, and how that might impact our future. May be part of the awareness so that we can pursue change. And that could include changes to substance use or just change in coping. Yes.
All right. So what can mindfulness look like? It can look like meditation, right? As I mentioned, a lot of times it is involved in meditation. This can be a guided meditation where, you're listening to someone walk you through something. This could be just purely sitting and experiencing nature. It could be going on a mindful walk, really just going through nature, trying to see, what am I noticing right now? It can be engaging in some breath work, really doing some breathing exercises, noticing, how can I work on expanding my diaphragm? Can I activate the body's relaxation response? This can help with reducing stress and promoting that calm state of mind. Can I engage in some grounding techniques? Really noticing, is there a way that I can feel more connected to the ground beneath my feet? Can I feel like one with my body? Can I notice, you know, my back against the chair? Can I notice my hands on my lap? Can I notice the blanket around me? Can I notice the wind in my hair? You could have just mindful moments. It could be that time where all of a sudden, you're outside and you see your kid laughing and playing with the dog, and you just kind of take it in and realize, wow, life is really beautiful. And you pause and you go, I want to remember this. And you take a minute to go, all right, what does this smell like? What does this feel like? What am I hearing? And really go, if I was to capture this moment in a bottle, what would I put in it? Could be doing a body scan, really checking in with yourself. In this moment, what do my toes feel like? What does my stomach feel like? If I was to describe what's going on in my nose right now, how would I describe that to someone? It can be really connecting with your spirituality, whether this be engaging in prayer, going to, a service for worship, really engaging in reading a spiritual text, lighting some incense, and just kind of becoming one with the universe, whatever that kind of means to you. Or really engaging in some yoga practices, some stretching. There are lots of ways to really connect with one's body and the environment. But the key is to be present in that moment, no matter what you're doing, to try and not let your mind wander too much. We're not going to be thinking about what do I have to do tomorrow? What do I need to pack for lunch? What is that email I need to send? Instead, instead, we're really focusing on the here and now. What is going on internally? What am I sensing? And how am I feeling in the environment that I'm currently in? And using that sensory information to help us feel calm, steady in that moment, and know that we don't have to do anything but exist for just that point in time.
Beautiful. And just to recap, self-compassion, which builds emotional resilience. Due to our mind's negativity bias, it's easy to focus on the hard things that are going on, which is completely normal. So the self-criticism, feelings of inadequacy, all those things we were naming. But self-compassion is that protective factor for anxiety, depression, substance use, all those heavy things that we carry in our backpacks. And we make space for emotions rather than judging them or criticizing them. Getting connected with the here and now, just like Ellie was talking about in the mindfulness practices, and remembering that we are not alone in the hard things that we're carrying. And if you ever want to try it, here's a little example of practicing self-kindness, common humanity, mindfulness, all those components of self-compassion. There are self-compassion break like activities online if you want to look them up. They're very well put together, very thorough, and they acknowledge each of these components. So feel free again, take a mental note of this. And if you ever want to try, just again, maintaining that groundedness and um, focus on breathing in a non-judgmental posture of oneself. Here's some resources as well for substance use difficulties or just if you're going through any kind of mental health challenges. These are some of the national resources. I know folks are coming from different places, so feel free to use these. Again, take a little picture of it. There are a lot of 24/7 resources here as well. Alrighty. Thank you all for tuning in, and I'll pass it back to you, Chantal.
Okay. Thank you. Where's, there it is. All right. Well, thank you for your presentation, Alex and Ellie. That was, yeah, it was really deep in there, with the compassion, and it feels like that's potent stuff that I think everybody can benefit from. So I appreciate you lending your time and sharing your presentation and your knowledge and wisdom with us, and a lot of useful skills and ways to like navigate working with substances. And so appreciate you both. And until next time, thank you so much. Yeah, if you're interested in supporting the work of Banyan Tree Women's Collective, we are always so grateful for donations to keep this work going so that we can continue to provide access to health and wellness to all. So thanks so much.